Hello everyone. Today we are going to discuss about process recording. From the title itself we will get the meaning of process recording. Process recording means nothing but recording of a process. What is the process means? The communication between the client and student nurses. So process recording is a tool used for the interaction between client and nurse. It helps to develop communication and interviewing skills of the student nurse. So there are two benefits we can see in the process recording. First thing is it helps to develop the communication capacity and interviewing skills of the student nurse. At the same time, it allows the patient to explore his feeling and he or she will feel relaxation. While coming to the process recording format, first thing is you have to write the identification data. Under identification data, you have to write the name of the patient, age of the patient, sex, address, religion, education, date of admission, date of discharge if applicable, MRD number, that means medical record number, occupation of the patient, attending doctor, who is consulting and who is the attending doctor of the particular patient, and information source. Information source might be the patient or sometimes the patient and relative or only the relative, whoever it is, that you have to mention. I will repeat again. You have to write identification data first. Under identification data you have to mention the name of the patient, age of the patient, sex of the patient, address of the patient, religion of the patient, education of the patient, and date of admission, date of discharge, MRD number, that means medical record number, then occupation of the patient, attending doctor, and information sources. This many things you have to note down first before starting the process recording. Then second thing is write the present chief complaints of the patient according to the patient. According to the patient, what he is feeling or what she is feeling about his condition, that you have to write. Then you have to write the chief complaint according to the relative's point of view or the person who is giving information about the patient. So according to the relative's point of view, what are all the chief complaints? That's the next heading which will comes under this process recording. Next heading is aims and objectives of the interview. Aims and objectives of the interview we can see for the patient as well as for the student nurse. For the patient, what are all the aims and objectives means? It helps to know about the patient's condition. It helps the patient to get socialized. It provides information about diagnosis. So these are all the aims and objectives for patient. Next, for the student nurse, it helps to obtain cooperation from the patient. It helps to improve the confidence of the patient. It helps to develop therapeutic relationship with the patient. Also, it helps to understand the patient's psychological behavior, problems, and signs and symptoms. So these are all the aims and objectives of student nurse. That also you have to write after writing the identification data, present chief complaints according to the patient, according to the relative. So these are all the main things you have to write before starting the conversation. Next, I will tell you the format, how we have to write this process recording. So this format which you can see in this slide, this format you can use for writing a process recording. So you can start with the name of the patient, Mr., Miss, Mrs., whatever it is, that you can write. After that you can write the place, then name of the hospital, date of admission, then date and time, then identification data you can write, then present chief complaints according to the patient, then present chief complaints according to the relatives. Then you can write aims and objectives. Aims and objectives for the patient, for the nurse. So you can note down like 1, 2, 3. Then you can write the aims and objectives for the student nurse as well as the aims and objectives for the patient. After that you have to draw the column like this. In the column, first section, verbal response of nurse and patient, what the nurse is saying and what's the verbal response of the patient. Then next, non-verbal response of the nurse. What's the non-verbal response that the patient is giving? What's the normal non-verbal response is given by the nurse? That you have to note it down. After that you have to write the therapeutic communication technique. Which technique you have used to do the communication? Either it is recognition, acceptance, information, communication, whatever it is, that you have to write under this therapeutic communication technique column. After that you can go to the evaluation, what you felt after doing this conversation. So after doing all this conversation you can go to conclusion and summary. You can finish the process recording. So this is the format of process recording which you have to follow while doing a process recording. Then this is an example for process recording. Here you can see the columns like students verbal and non-verbal response, patients verbal and non-verbal response, and therapeutic communication techniques and evaluation. I will help how to write this. First, you write good morning. Like that, you can start the conversation. Good morning, Mr. ABC, with a smile. So, here you can see the verbal and non-verbal response of the student nurse. What is the verbal response of the student nurse means good morning. And what is the non-verbal response means a smile. Then, what is the verbal response of the patient? Who are you? What is the non-verbal response of the patient? Looking nervous. So, you have completed that section. Then, you are going to therapeutic communication techniques. What is the techniques you have used here means giving recognition. So you are trying to recognize the patient. So what is the benefit of this therapeutic techniques? Acknowledging a client by name can enhance his self-esteem. Of course, that will increase his confidence to talk. So giving recognition is a good therapeutic technique that you can use in the first section of process recording. And after doing this, what the evaluation you get means I felt little overwhelmed. So after seeing the situations, the patient is nervous, so patient asks who are you. So after doing this conversation, what's the evaluation you are getting means you felt little overwhelmed. So this way you can do the process recording. Then you can start the conversation. You can introduce yourself. I am Jazz, a student nurse. I would like to spend some time with you. So what is the verbal thing you did means I am Jazz, a student, and would like to spend some time with you. So that is the verbal response you gave here. So what is the non-verbal and verbal response of the patient? That you can see in the second column. What you are doing here and how did I get here? So that's the verbal response of the patient. Then what's the non-verbal response of the patient? He looks anxious and raised his voice. That's a non-verbal response. And what is the therapeutic techniques you are giving here means giving information. What information you are giving here? I am Jazz. That's an information. A student nurse. That's an information. I would like to spend some time with you. That's an information. So giving information is a therapeutic technique, and informing the fact of communication will give confidence to patient to talk. Okay, that is the technique you have used here. And at last you have come to an evaluation that I felt a little intimidated when he raised his voice. So like that you can do the process recording. After doing the process recording, after like this, you can do the conversation and you can come to a evaluation. After doing this process recording, you can write the summary and conclusion and you can finish the process recording. So process recording is a tool which used to do the communication between the student nurse and client. It helps to improve the communication skill of the student nurse as well as helps to explore all the feeling of the patient. This is about process recording. Hope you understand. Thank you.